Hi everyone, this is Rick MacDermid with Senior Solutions Group, and today we're going to talk about the pros and cons of Medicare Advantage. If you haven't already, please subscribe to our channel and like our video if you feel like it is a benefit to you. So with Medicare Advantage, a lot of you are probably seeing all the ads on TV and all the commercials, and a lot of the reasons you'll see so many commercials for Medicare Advantage is these plans are subsidized by the federal government. So insurance companies make a lot of money off Medicare Advantage, and insurance agents can make a lot of money off Medicare Advantage as well, as they often pay a double commission for the first year if you're new to Medicare Advantage for the very first time. So the benefits of Medicare Advantage, there are a lot of benefits. One of the benefits is they do offer additional benefits above and beyond what Medicare covers, such as dental, vision, hearing aids. Often a gym membership is included at no cost to you. Also, you have lower premiums with Medicare Advantage. You can even often get a zero premium plan in addition to your Medicare Part B premium. You don't have to pay an additional premium, or maybe a very small premium for a monthly premium for the plan. Also, the plan offers all-in-one benefits under one simple plan or one simple roof, so you don't have to buy a separate drug plan. Also, you can often get a coordination of benefits under a HMO plan, so you might have a care coordination team which will help you map out your care to help you get better benefits out of your health care. So there is another benefit. There is a very minute small segment of doctors that don't accept original Medicare, but they do accept Medicare Advantage, so that might be another advantage to you. Some of the disadvantages to Medicare Advantage plans could be you may be hamstrung if you're on an HMO plan and your doctor leaves the network, or if you want to go to a different doctor that is not in the network. So another way around that would be to look into a PPO plan, which is a preferred provider organization, which gives you more options to go out of network to see a non-network provider. So you might get stuck if you're out of network paying the whole bill if you have Medicare Advantage. Also, with a Medicare Advantage plan, you would have co-pays or co-insurance, especially if you have to go to the hospital, the emergency room, or if you need physical therapy or speech therapy, or need to see a specialist. If you need that on an ongoing basis due to cancer, if you have cancer and you need chemo or radiation, often you might have to pay 20% out of pocket of the Medicare approved amount until you hit a maximum out of pocket, which could be $6,000 or more out of your pocket. And if that happens at the end of the year, such as November, December, and it bleeds into the following calendar year, you might have to start all over again and pay all that out of pocket costs for the following year as well. So that could really add up. So even though you pay a lot lower premium, you might pay more if you end up having a major health issue. Also, since the prescription drug plan is usually integrated in the Medicare Advantage plan, you can't get a separate standalone prescription drug plan. Medicare doesn't allow it unless you have a private fee-for-service plan, which is almost non-existent. So for all intents and purposes, you are stuck with the prescription drug plan that comes with the Medicare Advantage plan. If you're on original Medicare, you can enter your drugs into a drug plan lookup tool and find a customized drug plan that would meet your needs better than any other plan available. And we help people with that on a day-to-day basis. Also, with a Medicare Advantage plan, you may have to get a prior authorization for a test or a procedure or a surgery, and that can be a delay. So if you have a shoulder that needs repaired, they might require that you get physical therapy first before they allow you to get that surgery done. So you got to be aware of that. That might come into play if you have a health issue down the road. Now, there is an appeal process and a grievance process on all plans, so if you feel like the plan is not taking good care of you, you can file an appeal or a grievance. So another thing that you need to be aware of, and this happens from time to time, if people sign up for a Medicare Advantage plan and they're in good health, and then next thing you know, they have a whole slew of health issues. We all know people who've had great health and then the next day their health changes. You can't always go back to original Medicare and then buy a Medicare supplement plan, also known as Medigap, to lower your co-pays and lower your out-of-pocket cost. So those plans are only available when you're brand new to Medicare in most cases for the first 6 months, or you have a 1-year trial period for Medicare Advantage for the very first time. After you've used up your 1-year trial run and you have a lot of health issues or even maybe a knee replacement that's coming up, you may not be able to get on a Medicare supplement plan. So you need to be aware of that. What we do is we have a process to help you figure out what solution is the best for you. It's not one size fits all. We will give you the good, the bad of all plans, because there is good and bad with all plans. So we can help you understand how it all works, keep it simple and easy for you, and we can answer your questions. If you have a question that is just bugging you and you don't know the answer to, you're never bothering us. Feel free to reach out to us. Thanks a bunch, and don't forget to subscribe.